we did not have a big impact. Now, when we got the variants, but also because of what we had gone through with the first episode and the impact it created, the lockdown, the closure of schools for 1 year, and we saw so many teenage pregnancies and all that. So the children went back to school thinking that this would be something that will be managed along the way. But because of the variants coming in the country, because of widespread of infection in schools, and of course that meant that really once you get infection in the school, infection would spread like wildfire, and that's what is happening right now. So we could not take any more waiting. We couldn't wait anymore, and therefore that's why the president instituted these measures. Now, what are we doing to stem this infection? The principle of prevention of such an epidemic that is highly infectious and highly lethal. Yes, I know that 20% are the ones that get problems, and then maybe 10 to 5% you get severe infection. Even that 5%, what it takes to take care of that 5% is enormous. Enormous. A lot of resources, a lot of consumables, a lot of oxygen, a lot of everything is just extreme. So the steps we are taking right now is to go by that principle of minimizing crowds. How do we do this? That's why we are saying the schools that were really a center of infection, the children will disperse when they go. Of course, ideally it should have been, if we're able to handle, would be able to test every child, but it's not possible.
Doctor, we see that students were actually sent home, and there are a number of complaints that a number of students, about 30 to 40% that were actually sent home, some of them have been found to have COVID. So how should the ministry help the parents to sensitize them or aid them on how they are going to treat and handle this problem that is amidst them?
When we were closing the schools, we sent out messages, we sent out the circular, and we asked parents when they are picking their children to ensure that, to be on a safer side, they take those children and test them, and they get tested. Many did. They took their children, especially in urban. They tested, and they found actually a number of them were sick, and they were able to isolate them. The only challenge are those that are rural, whom may not maybe have gotten this information. Maybe also they didn't pick their children, the children went on their own. You find there are some, the parents are not able to come to pick their children. The children are the ones that are going by themselves. But still, we are still continuing to tell the parents to make sure that the children who came from schools, they could be potential source of infection in their homes. And we want them to, if you go to the district and you approach our surveillance team in the district and say, this child was at school, I'm not comfortable keeping her at home without knowing the COVID status, they would be able to test. And that testing should be free. And we told people, and up to now I continue making this clarification. People think that if you don't have money, you cannot be tested. Therefore, you'll go there and suffer with your disease. All our facilities, all our districts, the surveillance teams in the districts, they have what to use to test. The samples may not come, they may not be able to test there and then, because I don't think everyone has antigen testing capacity. But still they are able to take them to the nearest place where they can test at no cost. Every district has got a surveillance team. That surveillance team is headed by district health officer, and they have a task force that is chaired by resident district commissioner who chairs the task force. Therefore, to someone who comes with symptoms, someone who comes worried about the status or their contacts, that's why we call them contacts. And I do believe that children who left schools, they were contacts. Therefore, the parents, it is upon them to make sure that they take these children if they suspect, or if they see children with signs and symptoms of flu, they should take them to the nearest facility where they can take the sample and we test. Because if we detect early, then you are able to isolate this child and you save also the rest of the family members. Because I do believe that in some of those homes, there are vulnerable people, there are grandmothers, there are parents that are old, there are those that have other underlying sicknesses. Therefore, they must be protected. So that is number one, to ensure that any person who is suspected to have the disease or who is a contact of someone who tested positive, they should go and get tested. That way, you are able to isolate the sick, you are able to treat the sick, you are able to preserve the non-sick, and that way you are fighting the spread of COVID. That is number one.
Doctor, already there are reports of our health centers being overstretched. Here in urban centers, you find that all the health centers, both public and private, are actually flooded with COVID-19 patients. And of course, in the villages, we've had situations where even some health center threes or health facilities are not equipped. So can you assure Ugandans that this time round you are more than ready for this pandemic and that you have built enough capacity to handle this epidemic?
We are not more than prepared, and no one universally, no one globally, even the best economies in the world, COVID has put them on the floor. As Uganda, you know, we are developing country. Even our GDP is not even half of India. But you saw what happened to India. So we cannot say that we are more than ready. I think here what we have to emphasize, because we know that as a developing country, we don't have enough. We are still here struggling to secure vaccines. The developed countries are keeping the vaccines. Even when you have your little money you want to procure, you can't get. I think the best approach would be to make sure that we prevent infection. Prevention is better than cure. You will not tell me that you are prepared in a way that your hospitals become elastic. You will not tell me that you are prepared in a way that you have enough workforce to treat thousands of people who need every time someone is gasping for oxygen, and you say that you are prepared. Nobody can do that. I don't think that we should be able to talk about just preparedness to fill spaces and open stadiums and markets and open space for admission. No, because hospitals are not elastic. I think what we need to, what I really want to hear, even the media, even the people involved in community sensitization, is to talk about prevention, because prevention is better than cure. And prevention, you are saving a lot. Because let me tell you, people who are there, you are hearing the siren. For me, when I sit here, every second I'm hearing a siren. That means a lot. It means that all those people are requiring oxygen, requiring ICU, requiring, yet you do not have, yet the ICU is not elastic that you pull, you keep on pulling, no. So my request really is that we continue sensitizing the people about the dangers, and also to remove this kind of notion that we are seeing in public. Government etuyambe, these ones are concocting COVID. COVID is not there. COVID is political. They are looking for money to steal. They are coming up with the lockdown so that they steal money. Now, when we continue advancing that kind of talk, it is very sad. Apparently, some people believe. Maybe they are naive, maybe they are wicked. I don't know the right description. But someone tells you, this is a political concoction. COVID is not there. They are looking for ways of stealing money. COVID is there, anti-bagenda kubba. Some of us are here working 18 hours a day, and you hear someone is talking like that. Someone you find every day here, our people are falling sick because they are the front line, whether in the field, whether in hospitals, they are sick. So you are worried about your staff, your very staff, you are worried about your processes, and then you hear someone like that.
Now, let's look at the public, doctor, because the fight against COVID is a PPS, public-private partnership, that government has to partner with everyone in the fight. So what is going to be the role of the public, or what should be the role of the public in the fight against COVID-19?
So what we need to do is to follow what we told them to do. Very clear instructions are so simple, very simple. 4 things. First, wear your mask, and wear your mask properly. Not the chin. The chin can never wear a mask. Wear your mask and wear it properly, and wear a clean mask. If it is a cloth mask, wash it, so that it is not again going to endanger you by breathing in bacteria in your lungs and you get other pneumonias that will kill you other than COVID. Number 1. Number 2, avoid crowds, for God's sake. Avoid crowds. The crowds we are talking about, it can be even in your home. You have home parties, you bring people in your home, you don't know where they have been, you don't know what they were doing, and then they get you infected. Avoid unnecessarily participating in all these social gatherings. For God's sake, life is more important than going to a wedding or a funeral. I was talking to someone today who went to a funeral, and all the people who are in that funeral, all of them are sick. And we have been talking about this. So you don't have to go. Someone has died. Are you going to resurrect them? If you want to condone with someone who has lost, send them mavugo, but don't go. Don't go.
Even call them.
Yes. Wedding, must you? Didn't we see the best example of Bishop Kazimba's son, who went to church and they were like very few, like 5 or so, and they are happily married? Must you have a crowd? If you cannot, then wait, postpone. If you cannot wait. Must you be in a party? Must you be in all these groups that really, even now, even when the bars have not been allowed, we have seen bars that people are closing themselves in the bars, removing the lights, staying there until morning. And I have seen some people actually also confessing that they got COVID from the bars. So must you really go that way? So avoid crowds. Must you travel? Is it a must that you go in the buses that are crowded? Must you? If you must, if you don't have to, wait, postpone your travel, wait. Stay in your house if you must. Please go and work online, work smart. These days people are using online. And then you are able to work, to do everything. It's just for me, I have to come here because everyone is coming here. I can't do without being here. But some people, you can work from home. Avoid unnecessarily exposure of COVID. Number 4, hands. These hands are the source of infection. You touch the door, you touch where, now you came here. Before you leave here, you must sanitize. Sanitize, wash hands, sanitize, wash hands, sanitize, wash hands. By doing that, I can assure you, you will defeat COVID. Social distance. If I am going to be with you or to meet with you, I don't have to be near you. You sit there and I sit there. Even if you have infection, I will survive it. Go and get vaccinated. The vaccines even are there, but up to now we are seeing people waking up now, stampeding us. Oh, now, where can I go? Vaccines are finished. Where were you when we were begging? Of course, we are going to get the more vaccines, and we shall continue getting as more vaccines come along. But you do not have to demonize the whole process.
Yes, thank you for that, Doctor. Doctor, you sometime back, the ministry was promoting treatment at home, that some of the people actually should treat themselves at home. That was because some of the treatment centers were actually full and overflooded. Now, in this particular situation, how do you help the people so that they can be able to treat themselves at home?
Depending on where you are, everywhere in this country we have our health system, regardless of which place you find yourself in. It is true that sometimes in the village it is not easy to move from one place to the facility. But I know that most of our people, for example in town here, they have their clinician, they have their doctors they normally see. And all doctors know exactly what to do when somebody has COVID. If you are asymptomatic, meaning if you don't have any symptom, and you have just tested positive, they tell you you are positive, the best would be to go home, get your masks, put on, isolate yourself, and make sure that whoever is going to bring your food, whatever, if you can, stay with your cup, stay with your plate, so that you don't touch, and then the other ones who are carelessly will touch and then touch their face and all that. So keep your things in your room. Everything be self-contained. Even if you have outside the toilets or whatever, you can go outside and come back and close yourself in.
Doctor, we have a scenario here in Uganda where you find that the low-income earners are living in one room with a wife and with a child. Remember, our urban centers, our houses or residences, stressed that we have so many people and very few houses. So in the event that such a person who is actually living in a single room with a family of about 4 or 5 gets COVID, how do they isolate themselves, or how do they isolate any member of their family that has COVID? What advice do you give to them so that really they can live in a safe way without actually infecting or putting the lives of the people they are living with in danger?
Now, before we would get those people and we do quarantine places and put them there, but that one was very expensive. Because those people, you quarantine them, each one, you feed them for 1 week, for 2 weeks. Some even they seroconvert, and then you continue. And it was very, very expensive. All over the country to do that, it was very expensive and not sustainable. So that's why we opted for home-based care. Now, if you have a one room, you have your wife and your children, and you are found to be positive, most likely, by the time you get to know all those people, you have already given them COVID. By the time you test positive, if you are in one room with your wife and your children, most likely you'll have. If you have a place where you can go, you can isolate there. But if you may not, if you can't get, that is something that you just need to be with your family, but make sure maintain your mask, even in your house. Maintain your house, and make sure that you minimize any possible opportunity to automatically infect the other people. But of course, that is a very difficult thing, and I may not give you an answer because we may not have quarantine centers like last time. Now, if you find yourself that you have option where you can go, or you can move to staff quarter or somewhere, you go there, you isolate yourself, put on your mask, put everything there, if you don't have any symptom. If you have symptoms, get to one of the health workers you can get along. Because I cannot say call so and so. What if you are in Kanaka Pilipili? It's not applicable. So you need to look to use the facilities, the nearest. You can even go there if it is near. Can even go there and report and say, I am not feeling well. They measure you, they measure your pressure, they measure your sugar. Because COVID, one of the complications it does, and why those people with comorbidities get problems, the moment you get COVID, pressure shoots up, the sugar shoots up, and then you start getting real symptoms like as if you are diabetic. So when you still have those mild symptoms, still it is good to go and check, and they check you. But also you alert them. You alert the health worker that, I am COVID positive, but I came to check. Or you go directly to the hospitals where we are treating COVID if you are near. Like here, we have Naguru, we have Entebbe, we have Mulago, we have Nambole, depending on where you are. You go there and you report if you are not well. But some people, even when they are not well, they will choose to stay at home because they don't want to be in that noise. They don't want to go and wait there. And of course, that place is not doesn't have any pleasant look. To see people who are really, really, really struggling with life, it depresses people. So some people choose to stay at home. If you feel you are able, you can afford to buy your pulse oximeter, your gas cylinder, your oxygen cylinder, or your oxygen concentrator, just for purposes of like in case you get a problem. Then you can have it, and you can use it when you feel like you're getting maybe difficult in breathing. But yes, I saw on social media there are people who are providing those services, although we are concerned that they are taking advantage of the situation.
Just let's look at the transport sector, where actually the transport fare was more than tripled, so much that very many students were stranded. How would we address this?
I know that people want to take money, but I don't think that money has a blessing. When somebody is, when you are in a privileged position to help, okay? If you are in a privileged position to help, please help. Don't take advantage of the sick. Don't take advantage to make money, because that kind of money does not cause any blessing.
Now, Doctor, other than lamenting, don't you think really government should come up with a mechanism of actually handling this, so that unscrupulous people in the public should not take advantage of this situation?
But it is terrible. Where really I've been told that even simple medicines in pharmacy, vitamin C that used to cost nothing, they have increased 10 times. And you wonder what has changed, because it is the same medicine you've been stocking. What has changed? I do believe with all my heart and with all my being, that taking such money, you don't get a blessing at all. No. Because we are supposed, in this time, we are supposed to join hands to help. Where we can, we must help, and even go beyond just monetary. We are supposed to provide service without putting that advantage, taking advantage of the people who are unfortunate to get COVID. It is so bad, really. I think this one, I think we are going to discuss. I want to bring a suggestion to my colleagues here, and we have a meeting with the private sector, because it's very bad. And even now, what you are asking, what you are asking about, even testing, because I saw people lamenting, I am sick, but I cannot go to test, I don't have money. I said, but we have been talking about this, that when you have COVID symptoms, go to our hospitals. If they chase you, tell us. If they charge you, tell us. But also people are corrupt. Because there are the people who are giving money to those people in order to test, I'm told even vaccinating. Some people are taking advantage that you bring money so that I get you vaccine. That's not allowed. And the public must help us to fight this kind of decadence. How are we going to fight it if we are the one, you are sick, then you give money. But you're not supposed to give money to be tested. Government has invested, and we have bought these test kits. They are there in our hospitals. They are there wherever you go. Any hospital government, when you come and you are sick, they should be able to take a sample and take it for testing. For me, that is really, it breaks my heart. It's really, I just cannot understand how people can be wicked. That you will take advantage of people suffering, and then you want to fix someone in a fix. Someone who is dying, someone is gasping, is looking for oxygen, and you say you must pay for this. You must. Yes, I know that the private sector, some of them, of course, they use a lot of, consumables, but it is not equivalent to the money that we are seeing being charged to our patients. You go to buy vitamin C. The medicine is costing 10 times what it used to be. Vitamin C, a simple thing that it was so cheap. But people take advantage of all that. You go to the park because you are going home. The charge that they were charging you for 40,000, they put at 150. What kind of madness? What kind of greed? What kind of decadence is this? It is beyond. It is just, may God really have mercy on us. Really, I'm sorry. It's like I'm quarreling on Yeah, but it's really bad.
Doctor, let's look at how do we bring our energies together as a nation so that we can really collectively control this pandemic. Remember, Uganda, we have a very good history of controlling these pandemics. So this time around, how do we again do it so that we are as proud as we have always been, that we've always had a working formula for such epidemics and pandemics?
We must take out politics out of these epidemics, because everything has been politicized. You do this, they come after you to abuse it. So we must look at, because COVID affects all of us. COVID does not separate who is believing in NRM or what group. No, it affects all of us equally. Therefore, when we have such a war, all of us must join hands. All of us must respect the technical people, what they are saying. Because if I tell you that if you social distance, you'll be safe, listen, go by that. If you say, please vaccinate, when you get vaccinated, even if you get this infection, you'll not have, it will lessen the chance of you dying. Believe it, because even me, I demonstrated that this thing is safe and I've been vaccinated. I cannot tell you to get vaccinated, to use medicines that is dangerous, yet they have given it to me. Believe in your technical people. Please listen when we say, please stay in your home. This is a danger zone. Don't go to this place. Don't go to. You will catch COVID. Unfortunately, when people catch COVID, they cannot predict how they will react to it. Some, they get COVID and they don't feel anything, while others, they get COVID, they end up in ICU. So the best is to prevent. Lastly, is to educate our masses, to continue educating without getting tired. And let me tell you, we can actually put to end this COVID if we just chose to do only those simple things. Mask, social distance, avoid crowds, wash your hands, make sure you sanitize, and make sure that you avoid risky behavior that will expose you to those conditions of getting COVID. We want this to continue, to be a continuous process, so that it is not just a campaign mode, that now this week you are talking about COVID, after that you forget. I remember in December, around that, when we got the first wave, when we were talking, at one time we stopped talking, because every time we would talk, people would just abuse what, and because that time we were in politics had masked the message. But now politics is over. I think let's continue propagating the message of prevention, propagating the message of avoiding self-medication. I have seen people who came to the hospital suffering from the side effects of steroids that have even put their lives even worse in a situation to get more complication of COVID than COVID itself. They go and start taking dexamethasone. Dexamethasone is a very dangerous medicine. Dexamethasone, the doctor should be able to prescribe that. No self-medication of dexamethasone. So that message, it has to continue. We have to continue educating. Of course, there are so many things to talk about, but we can serialize. Self-medication, I can sit here a whole day and talk about self-medication and the dangers of walking in pharmacy and you just buy medicines and you take. The danger of that self-medication. And also it is contributing to other dangers other than COVID, because it is contributing to ill health of so many Ugandans because of self-medication. So let's continue educating the public, and hopefully, like Baganda say, embulira tefa yonna, as we continue talking, some people will listen, some people will do, and we shall save. some lives.
Doctor, I must thank you very much for sparing time off your busy schedule and really sharing with us on how best as a nation we can come together and fight this pandemic. It is actually possible if everybody plays their part. We can kick out COVID-19 out of Uganda and live a better life. It is your duty to protect yourself and your neighbor. Akol Amazima is my name, saying bye-bye.
The family of Mr. and Mrs. Alunyu Frederick Ogwal of Gulu City, with deep sorrow announces the untimely death of their father Alunyu Frederick Ogwal, who passed away on 8th June 2021 from St. Martha's Hospital, Lakar, Gulu. Mr. Frederick Alunyu Ogwal was a retired civil servant, politician, and a banker. He will be buried scientifically following the SOPs put in place by the government of the Republic of Uganda on the 19th June 2021 at his ancestral home in Omunya Ward, Adieda Parish, Bobi Sub-County, Omoro District off the Gulu-Kampala Highway. Informed are the Speaker of Parliament of the Republic of Uganda, members of Parliament, political and religious leaders, Major General Ben Francis Okello, the board, staff and management of UBC, the staff and management of Gulu High School, the staff and management of Gulu University, the staff and management of Sacred Hearts Minor Seminary, Lakar, the staff and management of World University Service of Canada, Uganda, the staff and management of Mulago Hospital, the staff and management of Christ the King Teachers College, Gulu, the board staff and management of Centenary Bank, the staff and management of DFCU Bank, relatives, friends, and in-laws. May his soul rest in eternal peace.
This week on UBC.
To eat the pineapple, to eat it, and also to, like, when you look at the pineapple, it has this mid-rib, the middle, the stem.
Yeah. Sometimes you cut it out and throw it away.
You know, because it sort of, it gathers all the toxicity, so it has that mechanism. So for the researchers, they've leveraged on that the concentration of bromelain is in that one. So they soak it in water overnight and then keep taking that water. And when you, maybe somebody starts out simple in a home like that, but in a laboratory you can go further, concentrate this and make a product. And that's what the Australians did. But then for me, I thought, oh, here we have pineapples. And coincidentally, there have been plenty since COVID started. And they are so cheap. And you see people laboring, begging you